Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
All right. Well, welcome everybody today to our Chronic Disease Collaborative Partner Spotlight. I'm Kyla Newland, Account Manager with Mountain Pacific, and today we will be speaking with Valerie Bixler. She's a clinical pharmacist at Anchorage Neighborhood Health Center in Anchorage, Alaska. ANHC, Anchorage Neighborhood Health Center, is the largest federally qualified health center in Alaska. So welcome, Valerie, and thank you for being with us today. I'll let you introduce yourself and give us an overview of your innovative pharmacy practice and the patients that you serve, and specifically speaking to those with chronic disease.
Thank you so much for having me. I'm Valerie. I'm the clinical pharmacist at Anchorage Neighborhood Health Center. We are a federally qualified health center. So what that means is we serve all patients regardless of ability to pay, which is really amazing. We see typically 30% Medicaid, 30% Medicare, 20% private insurance, and then about 10% of people have no insurance at all. But many of those are still underinsured. And so we fill in a lot of those gaps when they feel like they can't get the health care that they need. So it's a primary care clinic. So we see people for only outside ambulatory things, nothing acute, and which is really great. We also have lab, dental, we have a pharmacy on site, and one of our greatest things is our outreach program. So they help with people to get insured, help with enrolling in SNAP, kind of any of those other barriers that patients have to really achieving whole person health, and not just we care about your medications, we're going to send you home with prescriptions. We want you to have food, housing, clothing, anything we can do to help. And then my role as a clinical pharmacist is to see patients typically based on referrals from our providers when they're deemed really complex. And so I help with their medication management mostly, but also we talk a lot about lifestyle. So primarily I see patients for diabetes, but also we talk about hypertension, lipids, anxiety, anything that comes up that they just need a little extra help with.
Okay. And I know that you had a program there that was specific to patients with high blood pressure. Can you speak a little bit to that project and how that rolled out?
Yeah, a few years back, we got a grant from HRSA to help patients get at-home blood pressure cuffs, and that was really amazing. We were able to give out over 2,500 blood pressure cuffs to our patients, totally free of charge. And what that's done is it allowed people to be more aware of their blood pressure, since it is a silent killer and you don't see it coming. Often, we'll take a blood pressure in clinic, it's high, patients are like, oh, but I had coffee this morning. Then they go home, find out, oh wow, just kidding, my blood pressure is actually high all the time. Or even better, we're wrong and their blood pressure is actually controlled. Now we don't need a medication. It's been really nice. We definitely gave out blood pressure logs, trained everyone on how to take a good blood pressure, which was really awesome. We had some hurdles getting started because the grant was so specific of needing to integrate into, we use Epic, so integrate into their chart and give that data directly. There's a lot of IT hurdles to get started, but once we kind of figured those out and how to work around and work through our system, we were rolling out like 10 or 15 cuffs a day to patients. So the doctors really took it on to be like, you need a cuff, you need a cuff. It's ended now, but it really had great outcomes for our patients.
In addition to the outcomes, was there any improvement in your quality measures related to that project?
Yeah, at the 6-month mark, we started noticing that we were hitting our target for metrics of our patients are actually having controlled blood pressures, which has been one of the metrics that we struggled with. I don't think we've ever hit our metric before, so it was really great to see it actually is working. Patients are actually doing this at home. We're able to prescribe medications where they're necessary, deprescribe where they're necessary. It was just really amazing to see it works, and it was worth all that effort.
Is there any patient stories that you can think of that would show the success of having a pharmacist embedded in your care team?
Yeah, two immediately come to mind. The first was he's about 70-year-old gentleman, has some dementia. He was referred to me for diabetes management, and the main reason was he's on insulin and definitely needed it, but he couldn't remember if he took his dose or not. And so that's definitely scary, having someone with dementia. Oh, did I take my dose? I'll skip it. Now my sugars are really high. Oh, did I take 2 doses? And now we're ending up in the ER. So what we were able to work together to do, the first thing I did was get him on a continuous glucose monitor. That gave him some of the peace of mind, like, okay, if I do have a low sugar, I'll know about it. I can fix it on my own. As well as gave him some of those emergency products and trained his wife on how to use them if she needed to. He had a really bad fear of lows just from taking too much insulin in the past. Then we kind of worked together and we were like, okay, we'll set out a couple pen needles. Maybe that'll help remind me. It didn't seem to be working that well for him. But he really took up using a continuous glucose monitor. So I noticed, I was like, oh, wow, you're really doing well with this technology. Maybe technology is our answer here. So we started him on a mealtime insulin pen that records his doses and sends them to his phone. And so now he can check every time if he thinks, oh, maybe I already did my mealtime dose. He goes into his phone, looks, sees he hasn't done it. It's even better, it calculates the dose for him, so he doesn't have to remember, oh, at lunch I take 10 units. It'll tell him what to do. So that's been really great. He's actually, I don't see him anymore because he's done so well. I just get phone calls every now and again, like, I'm on a trip right now, I'm having a great time, thank you so much. He's one of my greatest successes. And then my other one is a type 1 patient. He got diagnosed later in life, at about the age of 30, and really didn't have any chronic conditions before that. So he was surprised and needed a lot of education. His first year being diagnosed with type 1 diabetes, he went to the hospital 36 times in DKA, which was pretty scary. And that was even with working with us. But he had some other issues as well, housing instability, food insecurity, just kind of all of the things that make it really challenging for him to have his doses and feel confident in what he's doing. I was able to get him on an insulin pump. And after starting that insulin pump, he actually stayed out of the hospital for 6 whole months, which was, he was going back every 2 days, staying for a few days. So it was really great. He's still doing well. He actually just started a new insulin pump a few weeks ago, and has not had any ER visits since then. So he's been a really wonderful patient. And he's very knowledgeable now. Sometimes I'll say something that I don't expect him to know, and he'll be like, oh yeah, my blood sugar goes 70 to 130 in the morning. And I'm like, oh wow, I would have guessed that you'd just tell me, 80, I don't know, something. So he really has listened, is taking it in, is taking control of his health.
Well, you are just a great example of the success of embedding a pharmacist into your practice to manage these higher risk patients or these high disease burden patients as you see most frequently. So what advice would you give to someone that wanted to either utilize a pharmacist better in their practice or embed a pharmacist in their clinical team in your experience?
I think the biggest thing is to just go for it. I think it's great to have a clinical pharmacist on board. We're able to answer so many questions. We have more time to spend with patients as well. We're able to build those relationships. It's so hard for our doctors in 20 minutes to really get to know what the root cause of all their problems are. So just having that extra resource, but just know it's going to take time to see those results. Got to build all those relationships, get the whole team on board too. That would be my biggest piece of advice is everyone has to buy into it or it won't work as well.
Well, do you have anything else to add, Valerie? Thank you so much for being with us today
Oh, thank you so
and
much.
sharing the great work that's going on in Alaska.
Yeah, so glad that we're all working together to treat Alaskans and we make everyone healthy longer. Keep everyone fishing.
Yeah, it's almost summertime.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you.